Dear members, welcome you all for a very interesting session today. A new batch of interns are coming from maybe next Monday or so. So before that, we thought we shall share the most valuable experiences we had during our internship and also some suggestions and inputs to make this internship most memorable and useful one. If you ask me now, at this, after so many years of MBBS, which is the most memorable time of your UG or PG days, I would undoubtedly say it's my internship. Yes, I had all my fond memories and which I cherish forever during my internship days at Bangalore Medical College. Yes, my first independent case I managed, first suturing maybe, or the times when we used to push the patients in wheelchair to the OTs in the night, first casualty patient which we managed with those adrenaline rush and night outs, night breaks with our PGs to restaurants, tea breaks, or some picnics or outings with our unit mates. So all the fun and all the activities, all the most interesting things done during our internship times. Yes. So to share more about their experiences, not just the internship, but simultaneously how can we make the best use of this internship time for learning as well as preparing ourselves for the future, that is PG entrance examination. Also to make the best use of the opportunities and what are the common mistakes we tend to do and how can we overcome that. All those things can be discussed today in this particular session. We have the student interns from different parts of our country working in different hospital setups, okay, who are our own core members of White Army, who are selflessly working to help others with us. And also they have proved that in recently concluded NEET PG entrance examination, simultaneously doing internship, working for White Army, and also they are prepared for PG entrance examination and they have secured wonderful ranks. And they also, all of them have qualified for PG seats as well. We have with us Mr. Kunj from LTMMC, Sion Hospital, Mumbai, who has secured a rank of 94, recently concluded NEET PG. Welcome to you, Mr. Kunj.
Thank you, sir.
We have with us Dr. Neha, who is doing internship at Bangalore Medical College and has secured a rank of 1400. Welcome to you, Neha.
Thank you, sir.
And Dr. Priya, all the vitamin members know her very well. Has also secured. She's a perfect all-rounder. She takes part in all the activities, even during internship. So she has also secured a rank of 14,000 or 12,000. Priya?
12,000.
Sorry. Okay. I just looked at your face, how it feels if I tell. Okay. So 12,000, and she's also wants to be a budding surgeon next. So she's with us to share her experience. Thank you, Priya, for joining us. And one of the most hardworking and one of the first ever core member we have, that is Dr. Pallavi from Mysuru Medical College, to share her experience today. Welcome to you, Dr. Pallavi.
Thank you, sir.
Okay. So let's start with Dr. Priya. Priya, how can we make as I already just told, internship is it's a mixture of hard work, dedication, learning, training, and fun, and somewhere you feel like demotivated or get lost. So everything is there. So how to make the best use or get the wholesome of this internship? You are almost at the verge of ending of your internship. So you had all the type of experiences or moments during this last 1 year in various postings or with the dealing with the patients, everything. So how to make the best use of this internship?
Yes. So first of all, I'd like to start by telling that internship is one of the most beautiful experiences in our journey as a doctor. And the thing is, it's like this is one place where you get to discover, rediscover yourself, know what your strengths, what your weaknesses are, work on it. So cutting to the main parts of this question. So I'd like, so the thing is, first thing, before you start your internship, I mean, most colleges give something called as a logbook, where, it mentions ki what you're supposed to pick up, what skills, what knowledge you're supposed to know, in that particular posting. So this is what I did when I started internship. Before each posting, I went through that, made a checklist as to what are the common, things that get diagnosed in a certain posting, what are the skills I need to pick up from that particular posting, made a checklist of that, so that as and when cases came and as and when I, saw them, I sort of like learned things that way. So that is one thing. Second thing is like, unlike 4 years of MBBS, this is not going to be a very organized learning. As and when patients come, as and when you're presented with situations, you're supposed to learn. And how learning happens is, one, definitely patients. Two, your PGs are going to be the people from whom you're going to learn. Three is that if we're blessed to have, excellent mentors, unit chiefs, professors, you're going to learn a lot from them. And then four, you're going to learn from, the textbooks. That is like, once you have, you can read up about a certain diagnosis, about certain procedures and all that from the books. So that is the second point I'd like to highlight on. Third thing, what I'd like to say is that throughout internship, from the beginning, do not do things blindly. Don't work mechanically. Each thing that you do, keep questioning why. So this is something I've been doing throughout. I still do it now. And it's a habit that you all have to develop. So say that, you're starting a patient on certain medications, or so and so orders have been given after admission, or that, you're sending certain investigations and you have to collect the reports, find out why, what you're expecting from that, investigations, how is it going to change the course of how the patient is being managed, and so on and so forth. And even before doing any procedure, if there is time, read up about it. If you're doing it for the first time, and you've done the procedure, then go back and read about it, because that is how you're going to learn and you're going to remember what you've learned. So that bit is also important. And one more thing that I do is, I love teaching people around me. So I teach my juniors, I teach my co-interns whenever I find an opportunity. And another thing is that I really have a good time teaching sisters in the hospital if they're around and, they ask me questions. So that is one more thing. And finally, internship is a beautiful time to network with a lot of people, starting from patients, PGs, people all around you. Keep networking, keep getting to know more people. So yeah, this is how, I would suggest on how to make it very, very meaningful overall.
Thank you, Priya, for that positive note on starting the internship. And next, Pallavi, I want to ask you, doctor is all about a personality. I always say it's not a degree or a profession. It's about a personality. Okay, so it's in your hand how you develop it, how you develop the personality, or how you transform yourself to be the better and better. Okay, so according to you, so you get a sense of maturity, or what to say, that kind of sense to become a good doctor. I want to be the best doctor in the society, and I want to help as many patients as possible. To do this, what do you think are the very necessary virtues or qualities to be possessed as a budding doctor, or as an intern, or as an intern? What are the qualities we need to possess to become the best?
First of all, internship, as Priya said, it is one of the very beautiful parts of our medical career. And for this to happen, first we have to develop interest in what we are doing. Without any interest in what we are doing, it's nothing that we are doing, right? So developing interest in whatever work is assigned to us, or what are we supposed to do, taking interest in the cases that comes, and asking why, as she said, what is the reason for whatever investigations have been sent, why this symptom is seen, what is the cause behind it, what is the pathogens. You might have learned it in pathology, but you think it, why that is happening here, what might be the cause for that. Think about it. Then you have to ask why, as you said. Then taking interest in the case and taking interest in monitoring the patient, because you are the most vital part. You are going to monitor vitals over there. Postgraduates or staff, they might not get time to do all those things. So you are an intern. As an intern, you are the one who is going to monitor the patient every now and then, and you have to take interest in monitoring it, because you might not know at what time the condition might go wrong. Remember? So you have to monitoring vitals is very important. Then you also get to learn about communication skills, how to talk with the patient, how to talk with the patient's attendant, how to interact with your colleagues, how to interact with your juniors, how to interact with your seniors. All these things are very important. There is a manner to interact with each and every person. You should not shout at the patient attendants. Usually, sometimes in a government setup, after a very long tiring shift, you might get frustrated. You might scream at the attendants. It will happen in a casualty, but you should know how to control that anger and talk to the patient attendants, because they won't know why this has happened. They might be losing a patient. The patient
What
might
you
be a
took
very
5 years to understand, you can't expect them to know in 5 minutes.
yeah
Okay.
yeah they might not know what is going on.
She may be the 100th patient, but for them, and it may be very small thing for you, but for a patient or attender, her son is the biggest thing in the entire world, and even a cold also is the biggest thing for them. Okay, very rightly said, Pallavi. You need to explain them. You should not get irritated or frustrated by your own personal shortcomings. So you should have a lot of patience, and you should be very empathetic. That point you need to highlight. Okay, what if your own mother or sister or brother was there in her position? Would you have spoken rudely or harshly? No. Okay, you would have helped as much as possible. No. So that empathy, you always see yourself in others. Okay, that empathy should to be highlighted. Come on, continue.
Then we might not get a lot of chances as interns, but we have to show the interest and ask for chances to do something basic also. Sometimes you might only be getting for documentation. You might be only getting works like documenting some things, like writing consent forms, all these things. But if you ask for any chances, then only you might get that. So you have to develop that interest and ask for chances with your seniors. And we have to learn to be quick on our feet. How to handle an emergency situation, you will learn once you are quick on your feet, because in future we don't know in what situation we will be. You might be posted to a remote place in the rural service that will be getting in future, and if some emergency situation comes, you should know how to handle that. As an intern, the basic thing you have to know is how to handle an emergency situation. You should be able to at least get the vitals of the patient stable. Then if there is no mm, things over there in that set, you don't have a infrastructure, right infrastructure, once you get the patient stable, you can refer to the higher center. Then what else? Yeah, basic thing is having patience as a doctor. Then you should be a good listener. You should listen to the patient's complaints, and only based on that. And we have to go according to what patient wants. Sometimes we can't be always forcing them to do this. Sometimes we have to listen to the patient and go according to their choices also.
So from whatever Pallavi said, I would like to stress on two things. Okay. So one thing is, like I already told, empathy should be there while dealing with the junior most doctors, budding doctors. Senior doctor they'll be just tell about the management and they may leave. So you are the one who always in contact with the patients and patients attenders. So try to be good with them, because it's a chance or opportunity for you also to develop your communication skills, management skills, and all. They'll be totally relying on you. Okay, so explain them what's happening, what the senior doctors have suggested, what's really happening with the patient. So by explaining all these things, doing good counseling, in turn you will also develop good communication and management skills, and the patients, attenders, and patients also will be very much thankful to you. That's the one thing. Second thing, what Pallavi told is, ask for the things like grab the opportunities. It's not that you always opportunities keep knocking at your doorstep. No, you have to go behind the opportunities many times. So what happens is, for example, there may be some during casualty night duties, there may one patient with lacerated wound come. Okay, if you just keep seeing or just writing some doing some clerical work, you'll be end up doing the same throughout the year. Instead, you should ask your PG or the senior there, sir, can I do suturing, please? Sir, please, sir, I will try once. Then no senior can say no to you. Okay, no senior can say no to you. Okay, if you say tells no, also there is no harm or there is no loss anyway. Okay, so always be the first one to initiate that request or conversation. Okay, so if you get, it's a bonus or a good value addition to you. Okay, so take all the opportunities to do the lumbar puncture, to put as many IV cannula as possible, especially the kids and all. It's very difficult to take blood samples from the femoral veins, to do venous cut downs. Any small, even the ascitic tap also. If you've done 10, do 11th one. That may be different one and most challenging one. It's nothing like if you have done, you are the expert or the you have learned everything. Nothing like that. Keep on doing as many as possible. Okay, I would say grab those opportunities. Third thing, observation. Like Pallavi told, good listening. Yes, also observation also a key. Okay, to success. Many times what's happened in private setup and all, there may not be many patients to learn, or you may not get opportunities to, but you can learn by good observation also, what others are doing, how they are doing, what are the mistakes being committed. All those things you can observe. If you're a keen observer, there's a lot to learn from others as well. Okay, so these are the key things you should one, grab the opportunities as much as possible. Don't leave any stone unturned to take up the initiatives and to do the needful. Second thing is, be empathetic to the patients. Third thing is, keen observation should be there. Okay, very good.
Also, discipline is also one of the most important qualities for a doctor.
I always tell this. Even your wards, when you are in the ward, no, even your wards also have got eyes and ears. Okay, these IMRs, group D workers, nurses, everyone will tell about you or give good feedbacks to your teachers or the whatever the in charges are there. See, that girl is working, sir. They are all because they know to each other for years or decades together. They tell the nurses and all, they keep observing you, what you are working, how you are with the patients and all. After their consultants leave, they will tell, sir, that girl really takes care of the patient very well. She speaks so well. She does the dressing so nicely. Okay, she consoles the baby so well. So these kind of feedbacks will reach the unit heads or the other consultants, and the impression on you or the amount of opportunities you get are proportionately high. Okay, exponentially high. So you don't pretend to do in front of the consultants. Instead, work sincerely to yourself or for your own patients. Be sincere and dedicated. And they are like, it's a discipline, timing. Early morning, you need to report at 7:30 means be at 7:30. Start doing your work without waiting for anyone. Start taking the vital parameters and other things, writing the notes and all. Evening also, try to finish off the work as early as possible, and then inform your senior, and you can take a break. Okay, so not an issue. Meanwhile, take care of your health also. Food, eating food timely, taking breaks in between. That's also equally important. We'll discuss on that. So this is okay, how to work and all, they agree. But before starting the internship, Kunj, I'm very sure you, I know you very well for last 3-4 years now. So you would have been very much apprehensive. Oh my God, that too in Mumbai. It's what to say, most happening place for any field for that matter, especially the medical. The hospitals are so hectic and toxic with loads of patients everywhere. So you must be very much apprehensive and bit skeptical also. Okay, how would it be? So far I have been just observing. Now that I only have to do the things. So how you were feeling in the beginning, and how did you, if there were some obstacles or the apprehension, how did you overcome them?
Yes, sir. So once the MBBS gets over, finally, now stepping into the internship, you always feel okay, now the work, I enjoy the period of internship. Everybody is telling it's the best period of my life and so on. So on day one, you go and report to your ward, and they just okay, they welcome you. Okay, you passed MBBS. Okay, oh, nice. Now go and do the put an IV line in this patient, do collection of this patient, send this for this. They'll give you a full entire list, and they'll go tell you, okay, in next half an hour
Until
to 1 hour,
itself.
you need to go and do everything on like in the like you are just like listening like listening to the PG what
You're
he is
lost.
telling. Yeah, you are lost. You're totally lost. Like what to do? Where am I? Where am I? So like first of all, you need to be calm and tell yourself, okay, I'll do this. And you should remember this like one line. There's the PGs also once were an interns who did not know anything at that point of time, but just by practice and practice, they are learning what they are telling us to do right now. So they also started from like they also start from square one. So you also like it's the first day of your life, of your like the infancy of your medical world. Like you're just newborn and you're like learning on all the skills like day one by what day one, day two, day three. You do not learn the entire thing on day one or in the first posting, whatever you have posted. So like even if you like on the first day, you can like it's okay to tell the senior or the resident over there, I don't know. Will you just like teach me teach me for the first time, and then I'll do it on my own on the further all the IV lines and everything. So like it's okay because many of my friends, even I used to feel like, how can I tell I don't know, that they will feel that this person does not know anything and they will not let you do anything further and like, know any special procedures also, they will not teach you anything. But like it's the like the what I learned over time is like it's okay, you can accept your shortcomings right now so that you don't have to linger that on further time. So just go and like freely just tell like tell the senior honestly whatever you feel. I don't know, sir, can you just, sir or ma'am, can you just teach me once, teach me once, and then further on I'll do it on my own. That's what confidence I can give you. So like just go and talk with the residents, and so like some of the residents are so friendly that they will like hold your hand, they will show you the entire procedure, like stretching the skin and then putting the IV and all the instruments which are required for this. And like you don't know, like there are people who are sitting there, you just need to ask them like, will you just teach me or not? And they will like open the entire encyclopedia, dictionary and everything. They will like just pour the knowledge in front of you. So like you will be very like you will love that the phase, like you like everybody is coming and teaching you. They will, when you ask questions, they teach you back, and that's a entire different type of learning which you may not have experienced till date, because it's like up till final year like studying, reading, giving exams, studying, reading, giving exams. This is like a different type of like communication. You teach them, they teach you, and it's a further on learning type of thing.
Mutual learning.
Mutual learning, and that's one thing. And another thing like is whenever like in every posting, you need to know the basics of that particular branch, because once you come out as an MBBS doctor as a degree, so a common patient will expect like, okay, this like as a basic skills what a doctor needs to know. Like for example, in surgery, you need to know about dressing, suturing. Then in OBGY, you should know about the basic delivery skills and all the episiotomy, suturing and everything. And in orthopedics, you should know about the slabs, tractions, and how to reduce the fracture and everything. So this all will only come when you just approach the doctor, approach the seniors, and you tell them, okay, I want to do this. I want to do this. Like you should follow the mantra which I followed, which my guru, like Kishan sir, just told me just before my internship began. Like you just go and tell, like, okay, yes, sir, I'll do it. I'll do it. I'll do it. Like these are 3 golden words which you should like speak in your entire posting, like each and every day. Whenever some senior will ask you, would you like to do this or perform this procedure, or would you like to get up washed up in this, or would you like to do that or not? So you just like without any second thought, you should just speak out these 3 words. I'll do it. I'll do it. So I follow that every time, and I got many opportunities of doing like many suturing, like CLWs, like even in my surgery emergencies, like from 2 a.m. to 5 a.m. But like everybody is sleeping, and I used to be in that dressing room with my first years and mama, like because eventually like the suturing is a skill which you can only get it when you practice a number of times. And whenever you are doing it like very thoroughly, like even the observer, sometimes even you learn from the brothers, sisters, and the mamas who are over there. They teach you much better than the seniors, because seniors are very busy in handling the emergencies and everything. So when you like the internship is a phase where you learn from each and everybody. Like you don't know, okay, even this person will teach you and so skills of like how clean a dressing should be, how to tie the suture and how to do the most simplest task which you would like would not have given a thought. Okay, even this could be done in such a simpler way and it looks cosmetically so better. So the patient will feel, okay, wow, this doctor has done such a nice and clean like dressing, so that he also will remember you. So in such a way, when the patients remember you, even after they are getting discharged, so whenever they come on follow up, they sometimes they really, yeah, they sometimes really ask like, where is this doctor? Where is this doctor? And it feels so nice. Like, the intern, if a patient is remembering you, like even the PGs appreciate. Okay, oh wow, see Kunj, they are remembering you. They are remembering you, and they will send the patient to you only to write the follow up notes and all the post-op advice and everything. So that's a great task, but this will only happen if you just go and expose yourself in the department, the field in which you are posted. So that's one thing. And one more thing, and in emergencies, like whenever you are there, like for like sometimes you are posted for 24 hours duty, sometimes like it goes on for 48 hours duty. So sometimes what I've seen is people bunk for sometimes and they go for rest and they like divide amongst themselves. So what I would feel, like if you are given an opportunity to work for 24 hours, so you should work for entire 24 hours as a whole, because eventually also you are going to be a resident over there. Because as a 24-hour duty, it's a different feeling. Because patients also see, oh doctor, आपने भी आराम नहीं किया, आप भी यहाँ ही खड़े हो करके, and then they also feel from a connection, and you learn a lot, because most of the things which happen towards the midnight phase, and many emergencies, many casualties come down, and you get to do a lot of stuff over there. So, and it's a different feeling because everybody's sleeping, you are working here and there, and you make some memories with your residents, they teach you. So that's also one of the main thing is how I would like to.
Very well said, Dr. Kunj. Okay, see, about the apprehensions, I would agree with Kunj. First and foremost thing, as soon as you start the internship, what you need to do is build relationships, build contacts, and good relationship with everyone. Starting from Group D, the security, the entrance securities, like Group D workers and nurses, with everyone, make good contacts and relationships. Okay, you only wish, as soon as you enter to the hospital, you only wish the security, good morning, bhaiya, khana kaya subah, breakfast ho gaya didi. So you only start conversing. So talk to everyone, make good relationship. That will help you a lot. And whenever possible, keep their phone numbers or contacts. The nurses, maybe the ward sisters or the OT technicians or the lab person contact number you keep. That will again decrease your work burden by up to 50%. Okay, so this is another way of developing your contacts and using it working smartly. Okay, third thing, Kun said, initially, see, you are the not first one to do internship. There are so many for decades or centuries together people have done, and this will continue. So need not be especially scared or something. Like if people have done earlier, means you can also do, as simple as that. It's not that it's first one big headache or some earth has fallen over your head and you are the only one who is doing for the first time. No, people have done, successfully completed, and people will do. So why can't you? As simple as that. Okay, and be honest. If you don't know, please accept. Okay, so I don't know, sir, I could not learn it before, so can you please teach me once? Be honest. That honesty is the best policy always. If you're honest, people love it more than you being so overconfident. Sir, I will do, sir, and then doing some crappy or nasty things. Okay, be humble. Don't think that oh, I may lose the opportunities and nothing like that. Be honest and learn first, and then only, because ultimately the patient, one who is get benefited or who get problem. Okay, so be honest, and only one thing I would suggest you is make contacts with everyone, good contacts, good relationship. Don't be like you will learn, like Kunj said, you will learn from even the security guard, also from the OT technician, from everyone. They'll only teach you better. In fact, I learned my how to conduct a delivery from a junior student nurse. She taught me in a labor ward how to conduct a delivery. She taught me. Even suturing, I learned from nurses. Even now, while operating, I ask sisters, sister, am I doing properly or not? Please tell me, is this okay? Is this wound? Everything before I complete, I ask them. their opinion, or whoever around, whoever seniors, maybe OT staff, anyone. I ask them, I take their opinion, only then I conclude. It's not that I'm a doctor, I'm in the whole and soul, I know everything. No such type of ego should be there. You should be ready to learn from anyone and everyone. Okay, if you are so down to earth and like ready to receive or accept things, you will grow like anything. You will be like, there is no limit for you. Okay, you will reach the heights, pinnacle. Okay, that's the learning point from Kunj there. So next,
Can I add one thing?
yeah.
The thing is, one among the fears are like, I believe everybody has this fear of being judged and making mistakes and getting scolded at the end of the day.
Yeah. No, Priya. See, this is nothing is personal here. I wanted to mention about this also in the beginning. Okay, so there is nothing personal. See, in our medical field, there is a hierarchy. As you all know, there is a big hierarchy system. Okay, so whatever happens, this is just to push from one hierarchy to another hierarchy. The HOD will scold the head, unit head. Unit head will push that anger on the assistant professor there. Assistant professor to senior resident. Senior resident will blast on all the PGs. PGs will scold their frustrations on interns. Interns will on the nurses. Nurses on the patients. Okay, patients will again put it on the HOD. So this, okay, that head didn't see me well. So this cycle goes on. So don't worry. Okay, nothing. It's not the Kunj has not done the work, or Kunj has not like done nicely. No, it's anyone in that position. As an intern, you are the junior most or the lowermost strata in the hierarchy. So anything that will be badly reflected on you only. So anyone in that, even if I was there or anyone was there in that position, would have been treated the same. So don't take anything personally or no hard feelings. Okay, I got scoldings. I am such a brilliant student. I got honors in my surgery, and still I got scolded badly in my surgery postings. Nothing like that. Nothing like that. Okay, so nobody wants to be harsh on you or rude on you intentionally. It's a situation makes them, okay, to be harsh on you, just to get the work done from you. They may be sometimes very strict at you, very serious at you. Okay, it doesn't mean that they have some grudge against Kunj, or they want to hook or crook. They want to show their power to Pallavi. Nothing like that. No, please. He may be very bad doctor, but he will treat you very nicely just because he want to be good with you. Okay, he want to like he wants Kunj to tell everyone that yes, Kishan was a very good PG. He was a good senior. That's what no ultimately it's required. So don't worry. Don't take anything personally. Okay, if anyone tells you anything, please, if any learning point is there, if any scope for improvement is there, please inculcate or just ignore it. Just ignore it. It's just the heat of the moment which makes them, or you know that PGs would have not slept for days together, or work burden, or some seniors would have forced on them. So that make them tell you like that. Okay, but next moment only, hey, come on, Kunj, let's go for have a cup of coffee, or come, let's go to like have a this thing and come. That okay, they also patch it up. Okay, so don't take anything personally, especially girls. No hard feelings. Okay. Okay. Next question. Important one to Dr. Neha. See, there are so many mistakes we do, knowingly or unknowingly, ignorance. I don't know why. Many mistakes being committed during internship. Okay, and like Priya just now mentioned, we are little judgmental. Oh, I did this mistake. How it will impact on my learning or further training and all. So Neha, what are the common mistakes as an intern we commit? How can we overcome them, or how can we prevent them?
Okay. So first of all, I would like to start by saying one of the most common mistakes is our perspective. So we start internship with very high expectations, and sometimes it's not fulfilled immediately. Like I remember creating a very rosy picture of what internship will be like, and on the first day, I expected everyone to just come teach me and. But you have to realize that a hospital is a very busy place, and it's a part of your journey. So internship is not going to be as easy as it looks once you look at it from when you're done with it. So like Pallavi said, it's up to you to take the initiative to be active. So what happens is you go with high expectations, you end up having a lot of work that is that feels like a lot of running around, like bringing reports, filling the paperwork, writing files. and that can be disheartening and it can make you very passive. But that's just a part of posting. So like Pallavi said, take initiative and ask for a chance to participate. So if you're more interactive with your seniors, they'll also tend to be more reciprocative. And like Kunj said, always take an opportunity to say yes. If somebody asks you to scrub in, then say yes. So try your best to participate. So that's one thing. If I had gone back in time and started internship now, I would have tried to be more active in my postings. Secondly, another common mistake is ignoring rounds or doing other work during rounds. Rounds is a time that everybody learns a lot because the head of the unit and other professors come, and that's the time you learn maximum. So make notes, take your own notebook, write down the notes, what you're learning during your rounds, and go ahead and read those topics. Like if there's a patient about CLV, you should, in your free time, just read about the case. It makes it much more interesting because passively, if a senior gives you some work and you find it a passive work, but if you read about it and do it, then
Neha get disconnected.
am I audible?
Yeah.
Hello?
You're
Yes,
audible.
Neha, you're audible.
Yeah, audible.
Continue telling about the notes making.
Okay, sir. Okay, you got disconnected. Yeah. So attend rounds. That's one of my main. That's one thing that I would say is a common mistake that interns would make. Secondly, don't get disheartened because, like Sir said, seniors might shout at you, get angry at you. So don't get disheartened by such experiences because like Sir said, there's nothing personal, and that's also another common mistake we make because we take it very personally. And we tend to become very passive, and that can also further affect learning. Next, whenever you're performing a procedure, always watch a video about it so that you can get an idea of how to do it. It's not just like you do learn a lot from the nurses, from the PGs and everything, but to enhance your learning, anything you do, even if it's as simple as drawing blood, or even if it's like taking a sample for ABG, always watch a video and try to understand how that works. Next, another thing is, meanwhile, internship can be very hectic, but whenever you get some free times, it's a good idea to solve MCQs because a common mistake is to go very late into postings, like 7-8 months, and then feel very overwhelmed and stressed about the incoming exams. So right from the beginning, if you start solving some MCQs, you'll at least feel more confident. And if you're in medicine, it's better to approach the medicine subject, maybe take up some questions from that, because then if you see a patient, you'll be more interested in it and things like that. Finally, I think this is one of the most important things, which I wish I had done better, is take care of your own health and fitness. Because it's very easy you'll have a lot of night duties, there'll be 36-hour duties for and very hectic hours. And we tend to eat a lot of junk food, which is available there, eat very fast. And these all take a toll on your health. And so I would say right from the beginning, we keep it a point to, take care of your health and fitness, eat healthier, and also take enough sufficient rest, because all these things are also important for learning. And at the end, internship is one of the most fun years. So don't forget to actually have fun. Make friends with the PGs, make friends with your unit, and enjoy the journey.
But Neha is a double standard, okay? She tells everyone to have fun, but she will have fun only by studying the free time mostly, okay? Okay, but see, see, I didn't tell it I told it in a very positive note, a positive manner. Even I worked in a similar setup like Neha, we both work, so I know how hectic it is. Okay, but I would take every opportunity or every problem as every problem. If it comes to you, I'll find an opportunity in disguise. Think for example, okay, now in MMC or BMC, I know many times PGs will just send you to fetch some reports, lab reports, or take this baby for X-ray. Okay, all these things work will be common. We think, why a doctor for that? Even a patient's attendant can do that. We think, but I will take even that circumstance also very optimistically. How? For example, if I go there, for example, when the patient gets that X-ray done and all, you may have to wait there for 10 minutes or 15 minutes. I would solve 10 MCQs in that time, whichever even I was there at the ward or the OPD, I may not have able to do. But if I go to take a baby for an X-ray, that 10 minutes extra, whatever I get, I can utilize for some fun by solving MCQs. Okay, so that's how you take every opportunity and turn into your favor. Okay, every problem or opportunity into your favor. So don't let any circumstances affect you. Okay, instead turn all the circumstances or situation around you to be in your favor by utilizing them very in a positive manner. So still, whatever, how much optimistic we are, good we are, sometimes something bad happens, especially when we lose, or like Neha said, there's high expectations. When they don't meet, so we get disheartened, demotivated, we tend to become passive, right? Especially the one who we treat them day in day out, the patients, when they don't do well, or especially some when they die, okay, we feel really bad. Okay, we tried so hard, we did the dressing for so long, even then he succumbed to the sepsis or died. All these things happen, okay, many times, and some people are very emotional, very sensitive. We can't bear the death in our hands, or we take it very, oh, all happened because of me. We tend to think like that. So Priya, how will you manage such situation? How do you manage grief and such negative reactions?
So there are a couple of things I'd like to highlight here. First of all, it being like a very sensitive issue. So like the first 2-3 times that you actually witness a patient dying in front of you, some of them maybe, bought into the casualty and then, they are declared dead, or some of them may be patients you have seen from admission till the end. So the thing here is like the first 3-4 times it hurts really bad, but then eventually it becomes a very numbing experience is what I have felt. And I talk to the closest people I know about this thing in order to overcome that. So that is one. I remember the first time I was posted in NICU. I mean, so normally what happens, like a baby is born and then in a normal delivery, and then the baby is like handed over to the mother, and then they shown to the relatives, to the parents, everybody outside, and there's so much joy. And there was this kid on the first day of my NICU posting, extremely low birth weight, already having been admitted for 2 weeks with sepsis, intraventricular hemorrhage, name any complication, it's there. And my work as an intern there, because the parents were not there for 2 hours, and the saturation, I mean, the baby was actually tanking. So my work there was to just give bag and mask to maintain the saturation till when the parents came. And what I saw after that, like once the baby was gone, the parents were brought in, they were in tears, they were shattered. And the next thing I see is that the sisters, they are like wrapping this newborn baby with all these, yellow colored, clothes and all of this, cleaning up the baby, wrapping it in order to hand them over to the parents, but of course for another end. So that was my very first experience, which sort of was quite mind-numbing, and I was quite sad after that. But yeah, as and when you see such experiences, it's like it becomes numbing. You learn how to deal with it. That is one. Second thing, what I'd like to highlight is it is very important for you to see from your seniors how they counsel the patients. When this happens, how the patients, how the relatives are being prepared for this in case they're expecting a bad prognosis or a bad outcome. And you need to be a part of that process to see, how they're being counseled, how the conversation's happening. And third thing is that if a patient has died, then I think it also becomes important for you to go back and review as to what could have been done better. So these three things are what I'd like to highlight on.
So Pallavi, how you will manage?
I would like to tell that, like on the first day of internship, I saw death in medicine. I was posted to medicine casualty, and there was a patient going bad, and I didn't know what to do. It was just I was just posted, and around it was just 2 hours of my internship, I think. And I just stood there watching. I had no idea what to do, and my seniors were giving CPR. It was a very traumatic experience for the first time. Then on the second day, again, I saw death due to dialysis, death after dialysis. The patient suddenly went into hypoglycemia. I had monitored the patient till midnight, and then I had explained about the patient might go into hypoglycemia. Please kindly feed the patient, give something. And the attendants didn't do that. And after I left, around 1 hour after that, suddenly the patient went into hypoglycemia, and the patient collapsed. So consecutive 2-3 days of seeing this, and I was pretty shattered actually. And my seniors, there were seniors in interns by then, like last 2 weeks of posting they supported me through it. They actually gave me a little early break, because so that I can relieve myself, I can get a little bit of rest for that. And because they were used to seeing that, and after some time, I think I got used to seeing that in a very emergency, like ICU situation. Sometimes it is very difficult for the patient to come out of that. We should be prepared to see that if the vitals of the patient is bad. And as
What
I
happens, see, what happens is, really, you're all working in the tertiary care centers.
yeah.
Okay, medical colleges are nothing but tertiary care centers.
Mm.
You get you never get simple cases or straightforward cases.
Yeah.
All the critical cases or at the end stage only they come to you.
They come to tertiary.
Okay, they never simple fevers or small cases will never come to you. Those who are almost in the deathbed or very critical, at last they'll be referred to the your Mysuru Medical College Care Hospital, and then they expect you to do miracles. It's not possible, impossible. You are also humans. You can try your level best, but the results are not in your hands. Okay, so you do your best without any.
Our best, yeah.
Okay, you should try to do whatever the best possible. Okay, then results, don't expect the okay, anything out of that. So that all
But
depends.
giving our 100% is most
You have done a
important
very
thing.
good surgery, but patient doesn't recover. That doesn't mean that you're not done correctly or properly. When the patient factors matters, he may have some immunosuppression or something which is against the good wound healing, like that. So many factors, doctor factor, patient factor, the environmental factors, many things really matters for for the patient to get well or so. So you do your karma, your work, whatever is assigned, whatever your responsibilities you do, rest everything will be taken care. Okay, that is the take home message in this regard. Now I would like to ask two of our star performers, Kunj and Neha. Like, see, many students every day message me or call me asking, especially just before the entrance exams, many were asking, sir, can I take 1 month or 2 months off from internship to prepare for my entrance examination, or should I continue internship and study? So many, especially in some there are some colleges where interns never go to the hospital. Instead, entire year they spend on preparing for entrance exam. So a lot of trends like this. So according to you, Kunj and Neha, so what is the best, not best, what's the way forward to prepare, like to do internship simultaneously, prepare for PG entrance examination? So what will really work out, Dr. Neha?
I think instead of rushing at the end, it's always better to start preparations from the beginning in like a slow and steady manner. Like you said, if you get breaks in between while shifting patients, you should utilize that to read and to solve MCQs. Because even if someone doesn't keep in touch with all that from the beginning and even then and takes leave at the end, that will also become very overwhelming. So it's always good to keep taking grand tests in between on days that are less hectic, and just spread out the preparation throughout the internship.
So if you're started from the beginning, then no need to take a leave and all at the end to just for some extra preparation and also from the beginning, the hard work should be regular and consistent. It's not that just 2 months before the exam you realize it's high time and start doing everything at once. No, from the beginning only put some 2-3 hours extra to study or prepare, so that at the end you will be only have to just do some quick revisions. So it will save your time also. So 2 months of very crucial internship also. So that's what Neha is suggesting. Start the preparation well in advance from the beginning of your internship. As you are posted in different branches, try to finish up those subjects. Okay, and you have a target at the end of 10 months. I will finish up all the subjects, and last 2-3 months I'll utilize for revisions before the entrance exam. Kunj, what do you suggest for your juniors? How to prepare, and they want to perform better than you. Okay, they want to take like less than 90 in their internship itself. So how can it possible? What you could not do, make them achieve. Okay.
Yes, sir. So definitely, like as what Neha said, like start early, because starting early only makes a better, because you get enough time to spread out the preparation throughout the internship phase. And one thing, like wherever you are posted, in whatever department you are posted, I'll suggest you should be mentally and physically present at that particular moment, because whatever like the clinical questions and everything, whatever is being asked is whatever you are seeing it day in and day out. Like focus on the clinical signs and symptoms. What is the further plan of action? Like if you are taking the patient for an X-ray or a sonography or a MRI, like just question in back of your mind, like why is this patient being taken for so and so, like in what sequence is the patient being taken? Like first you do a basic investigation like X-ray, then if further doubt, then followed by USG. If still further doubt, then the major investigations like CT scan and MRI are done. So just question like each and every step, like why are you doing this step, and why is this step being done first, and why is this step being followed after you are seeing the results of or whatever the investigation is giving you. Was by doing this, you will organize all your thoughts and whatever you have learned in all your 4 years of MBBS in a symptom in a clinical oriented manner, because whatever questions are being asked are in the same way. The question asks about what is the best next step, what is the best step you will do next. So all that comes, because in that case you don't do what is the gold standard in investigation of choice. That all is only in theory and only in books, but whatever you practically you do is the next step which you will do. So this way you will understand what to do and be present at that particular moment. Keep your eyes, ears and everything open. So grab information from whatever source you get, just grab it. So that's one of the things.
So decision making has come from within. Okay, first,
yes.
See, the morning rounds you do first. So first you decide, first you think. So this is the case has come with acute cholecystitis. So if you are the consultant, if you are the chief of the unit, how you would manage? First you think for yourself, not just putting a notes, just via pulse rate is this thing, BP is this much per abdomen, soft, non-tender, mechanical. That's what she told in the beginning. Don't work mechanically. Every patient is a learning point there. Okay. So first, while putting the notes, like think for yourself. If you are the consultant, what you would have done next? If she's having pain, what you would have done next? What you would have given? So everything you plan for yourself. And during the rounds, when they really discuss, then you can analyze. Okay, I was also thinking the same thing. Next, I thought I would get a MRCP done. So even the sir has told us the same thing. No, sir is telling something different. So why? So you analyze things like that. So that will help you to solve so many, maybe 10 or 20 MCQs.
Yes.
So main thing is what you require is the thinking capacity, decision making capability. Okay, no, like Kunj said, theory is totally different. What you do in your internship or your practical life is totally different. So for that, you need to develop that analytical skills and the logical reasoning skills. That will come only when you involve in every work you do, not just mechanically doing clerical work or some, then you tell everything is now my next question is that only to Priya. Many interns, they say, my internship is very hectic. I'm not able to do anything. Okay, I'm not getting time to study. I'm not go enjoy, I'm not able to do any extra work. I'm not able to take vitamin classes. No, right? So many of your okay, so you tend to say that. Why is that so? Is it really hectic, or this or so many SCUT work you say? So it's very tedious. Okay, so many clerical works, so many complaints. Okay, as if you are only the one who is doing for the first time. No one else has done time before. So why you? What's the reality, Dr. Priya?
So there's two spectrums to this whole aspect of SCUT work. I mean, first thing is that from I'm sure all of us would agree to this. This continuum of patient care, which is there right from admission to discharge, there is so much that happens. Like starting from the admission orders to writing, the notes every day, to checking on the vitals, to collecting the samples, getting the investigations back, accompanying the patient to radiology, following up on those investigations, and then this whole thing of discharge summaries, which you have to sit and type. One thing about discharge summary is it's very important piece of information, because it does tell the patients what you are supposed to do after getting discharged, what are the warning signs, and in case the patient goes to another hospital or comes for a follow-up, you know what has happened beforehand. So that is there. But so yeah, that bit, if you look at it as a continuum of care of the patient, then it is a wholesome process you get to learn. But the other aspect over here is when, there's this thing where everybody says, interns are treated as clerks or, worse than Group D workers. Because in some postings, what I have noticed is that we just sit in the discharge summary room, continuously typing and printing out 25 to 30 discharge summaries just like that. So, 8 a.m. to 4 p.m. only that happens. Nothing else we learn. So that bit is really, really, disappointing, because at the end of the day, you go back feeling like you've done absolutely nothing, because you haven't seen the patient from start to ending. You're just typing random stuff. You don't know what has happened. And that piece of information doesn't make any sense to you at all. So that is there. And in the OTs also, sometimes what happens, this has happened to me with respect to my minor postings though. They'll be like, okay, fill up those registers. When you're actually watching something, you want to learn something. So that does happen. Yeah, as much as possible, I try to go and ask my seniors, okay, can I just see this? Can I finish watching this? Can I do this and then come back and follow up on the discharge summary or follow up on the investigations? And sometimes if the seniors are like really good and they notice that you're putting in efforts to learn something during that posting, they will only make sure let her finish doing this, or let her finish watching this and then go back. So if those are the circumstances, fine. But still, it is quite disappointing to just sit there and print discharge summaries the whole day. Yeah, I think that is something which the system should address.
So, yeah, agreed. System, very difficult to change the systems or trends. What you can do is, again, as I said, enjoy that also. What's happening, if you really enjoy doing that, you will not complain or you will not feel bad about that. Even what I would have done is, I would have taken only one positive aspect from whatever you told. See, it's a very discharge summary. It's a very most important piece of information to the patient or patient attenders when they get discharged. Even whatever the treatment, whatever we done is secondary. So what the paper he carries, no, that's of utmost important. So I am doing the most important work here. I'm helping the patient a lot. So if you carry such thoughts in your mind, and I'm a perfectionist. Even small things also in discharge summary is it should be so proper. Okay, and I do that so nicely. How can I make it more useful for the patients and other doctors who refers these sheets? Okay, so and now we are doing if you do all these works, basic works, clerical works, everything, when you become a consultant, you will know definitely, since you have done all those things and come up, then you will know, yes, where the really mistakes happen, where the patients will have inconveniences, where the information goes wrong, when they tend to do the things wrongly. So everything you will know, because you have a first-hand experience. You have gone through all those spaces. You have seen how the X-rays, that patient's queue will be there, how long the waiting will be there, how much time they take to take an X-ray. Because since you yourself have been taken a patient there, and got it done. Otherwise, sitting in an OPD, how you'll know? You were written like a patient in emergency casualty, or written X-ray and sent him. How you'll know what's happening there? How much time it will take to shift? Like when I can post him for the next surgery? Who will have an idea? If you know that, yes, it takes 10 minutes time. How much you're fast? For example, you expect some of the tests to be done immediately. Your PG will order you, get this done now, because he wants to do surgery. Okay, so he will put it on you. Now get this done, this test in 10 minutes. Okay, so you know, because you have been there. For blood grouping to be done, the minimum to 2 minutes to chahiye. If you just do that, this thing, what is that, ABO compatibility also, to do RH compatibility, minimum 20 minutes required at any cost. You cannot be done before that. So if you, because since you have seen that in first, as a first hand, you can tell that, no, sir, how much are you force me? It takes 20 minutes to do a proper cross matching. So I have to wait till then. Otherwise, you will also be in a hurry going here and there, lost. So it's good. Always take everything positively. Go to every like field of the hospital and know what's happening there. So what happens once you become consultant, you will never do that. This is the only time where you will go and speak to everyone, get first-hand experience. Once you are surgeon, you'll sit only in the OT and OPD, and you expect everything to be done immediately, then and there itself. Okay, if you have seen, if you have done all these things, you will have a fair idea. Okay, how long it takes. How it's being done there. Okay, so take everything positively as much as possible, and all these are learning, and it's only temporary, only for 1 year. You'll not do same thing for lifelong. You're not a clerk for lifelong. Okay, you just for 1 year you have to go through all these things, and rest 99 years you'll be just a consultant. Priya, you'll be doing surgeries entire life. Okay, there's long time ahead for that. Do surgeries now. Just that 1 year in your 100 years life, you have to do this clerical work or whatever this. See, that's why I'm telling, because how to take everything positively. Okay, that's my intention. I agree with you. It's not okay. Many times circumstances are not good, not in our favor, but we can't change it by cribbing that. Nothing will going to change. Still, we can make it in our favor by taking good points or some favorable points out of these. You understood, Dr. Priya?
Yes.
Okay. So,
Sir?
anyone to
Yeah. So I wanted to add something. Like what Kunj was saying about observing things in when you're working. So I think like that's very important, especially now. Like even simple things like if you're doing catheterization, then you should observe the different options. Or even if you're putting an IV cannula, then the different sizes, the flow rates. And if you're collecting sample in vacutainer, then you should also observe what the order of draw is and things like that. Because finally, these are the things you have to remember, and also, I mean, practically it's useful. Plus, these are things that will also be asked, because now things are more clinically oriented. Secondly, internship is a time to get to know which branch you can take, because what you would like. So whenever you start a posting, just try to look at it in a wholesome way, so that you can understand if this is a branch you want to spend your entire life doing. So because at the end of the internship, finally you'll have to pick one.
You have to decide which branch you want to take up. So if you have practical experience, okay, see in the MBBS days, you will have a fascination. Yes, I want to be a gynecologist, or I want to be an ophthalmologist. Such fascinations will be there. That's only just imagination, or just from others' experience. But when you yourself are Neha, when you worked in ophthalmology, you realized, okay, whether I'm really fit for this, whether ophthalmology is really apt for me or not, whether I can sustain the pressures here, or I am able to manage the work here. So everything came to know for yourself with practical experience. So that is the best way to decide or make decisions with the practical experience. So work in all the departments with full enthusiasm. So at the end of the internship, till then be like open-minded. So many times what happens is you will be already prejudiced. Yes, I want to be a you myself, I did the same mistake. Okay, I want to be this branch. Okay, so what happens? Your efforts or interest in other branches goes down. Okay, you will not put your full efforts there. So at the end of the day, you don't know. you may suddenly your decision may change. See, I was preparing for UPSC throughout my MBBS. Even in internship, I was preparing for UPSC. I had got a lot of opportunities during my internship. Many consultants gave me appendicectomy to do in internship. But I was like, no, sir, I am an IAS officer. Why I will do this appendicectomy? And I was okay. Now I'm repenting. See, I'm a surgeon now, and see, I would have done much better. I could have done much better now if I had utilized those opportunities. So no opportunities will go wrong, go wasted or in vain. Okay, so utilize. Be open-minded. Yes, I am open to ready to do any work, anything. It may some or the other way it will help me in the future. So okay, so be open-minded, and when you after working in all the departments, then make a decision, wise decision, which really suits you, your personality, the best. Then you can go ahead with your according to your rank and all. You can choose a PG branch of your choice. Very good, valid point made by Neha. Now we have with us.
I would like to add another point in mistakes that we do in internship. Not learning regional language, and also not doing our work properly. That is documenting vitals and all. If you are just winging it like that, not checking and simply documenting, sometimes all these things are some of the common mistakes that are done.
That see, language issue doesn't suddenly arise in internship. Okay, that is the mandatory thing as soon as you join the medical. Okay, MBBS itself. If you are in Gujarat, you have to learn Gujarati. No way out. Okay, because 4 years you should take cases. I have to present cases without a language, which is not possible. This suddenly this issue doesn't arise. This should not arise. This arises, of course. Many people even recently concluded exam. One student was asking me, "Sir, I don't know language, sir." I'm like, what you did for last 4 years? You can't ask me suddenly at the now that you don't know the language. Okay, 4 years at least. Some 4 words you could have learned and taken a case. So all those excuses are not there. And second, Pallavi, what she told is absolutely true. Don't falsify things. So don't simply see one wrong pulse what you have written may end up costing a life for the patient. You have written without checking. You have written 60 pulse. So everyone thinks that okay, normal. Instead, he might be having tachycardia, pancreatitis patient. Suddenly, they go into hypotensive shock and they die. So if you're really picked up that pulse, okay, he's having some tachycardia and BP is also low in the ward. Then if you pick up, then he might have been saved. Patient would be saved. Okay. If you miss that, because patient from out appearance he looks okay, but the starting like hypovolemic shock is starting with the tachycardia and hypotension. Or if you are picked up by proper examination in the beginning, then life would have been saved. So don't have such repentance later on by doing all these things. Okay, so do it properly. Very good. And now we have with us one of the new member of a fraternity, medical fraternity, Dr. Anjali Patak. So she recently completed the final exams and with good results. Now she has become a doctor. Congratulations, Dr. Anjali. And she's a very active member of White Army, presented so many cases and contributed a lot. Now, as a beginner, like next week or so, she's going to start her internship. She may be having so many thoughts going in her mind right now. After listening to the seniors, many things would have been got solved, but still some more things she want to ask. Dr. Anjali, over to you.
So first of all, thank you so much. The session was really nice. Almost all my apprehensions got cleared, but still I had some doubts that I want to ask. So first thing I wanted to ask is that what are the minimum skills that we should learn from each posting? Like for example, medicine. What and all we should know after finishing the medicine posting? Surgery, like that I wanted to know like what we should learn. And second thing I'll ask after this.
Second round?
Second question was regarding NEET PE, sir. So it's a kind of long question. After this question,
okay. Who wants to answer? Pallavi, what are the minimum skills you should acquire in each posting? Is there anything like that maximum, or as much?
As much as possible, we have to try to acquire, as you said, and at least how to stabilize the patient. You have to know how to in an emergency situation, how to handle, be it checking the vitals. You might have checked BP in physiology practicals. You might have got normal 120/80, but in that patient, you might not get that proper BP. You might not even get it in a palpatory method. You should if you might not get an auscultatory, you might get it in palpatory method. Then that one is checking vitals properly, then drawing blood, catheterization, putting a Riles tube. All these things are the basic things that you learn in an internship. Then how to manage regular OPD cases like diabetes, hypertension, how to start the treatment at least. You should know the basic protocol. And then regular cases in a surgery casualty, how to suture. That is the basic thing. Then dressing. This one. Then what else we can tell?
Orthopedics.
Wound. Yeah.
Cast.
Orthopedics. Yeah. Cast, slab, all these things. How to manage a fracture case. Then in anesthesia, you might get to intubate, give a spinal anesthesia. Spinal anesthesia. Then
ENT?
In OBGY,
yeah,
like
ENT. Labor. Normal delivery. How to do a normal delivery. Then episiotomy suturing.
Delivery. Very good. And episiotomy.
Episiotomy suturing. Then you might, if you are lucky enough, you might also get vacuum delivery chances also in tertiary centers. You might get.
Ophthalmology.
Then ophthalmology, it was mostly clerical work for us. Then we got to do refractometry, then biometry we got. Yeah.
What is it? Snellen's chart?
Yeah, checking visual acuity.
Yeah, visual acuity. That one.
Snellen's chart, no?
Then
Most
Snellen's
camps,
chart.
that's what you do. Check the visual
Camps, lot of
acuity.
camps in ophthalmology.
Yeah, lot of camps.
See, my question, see, what if Anjali gets community medicine posting as a first
First
posting?
posting, I have community posting only, sir.
Yeah, really? I didn't know.
I started with community medicine posting for 3 months.
First posting is
They are telling me. First day only she was posted in some peripheral clinic independently. Okay, she is the only one who is posted, and she has to manage 100 people long queue in the first day. What will do, Pallavi? Yourself, your experience, you tell Priya.
Yeah, Priya.
First day
So
of
was it 100 people? So the thing is, when you're in a PhD, there is a sister as well. And the thing, just it's first day, right? Just start, take it one at a time, stay calm, and keep asking history, keep examining. And one thing I've noticed about PhD is, before you enter, find out what are the medications which are already available there. In the table will have so many things kept over there. So for common symptoms, you know what to give that way. And definitely, if you do not know what to do, please take help of people. That's all. Most of the things over there are very commonly encountered.
That whatever sister you told, no, she knows everything.
Yeah.
She knows everything. Just you should be very humble enough to seek her help. Sister, I am new today. Okay, I have only theory knowledge, but I don't know what to do here. Please help me. If you tell, she'll be more than glad or interested or to help you. Okay, डॉक्टर जी वो कुछ नहीं है, वो उसको लिख के दो, एक पैरासिटामोल दे दो, ठीक हो जाएगा, कुछ नहीं है उसको. और वो just tell sister, give an injection. She'll know dose, everything she will manage. Okay. You need to know that for if any pain patient comes, you should give a diclofenac injection. That's all you need to know. Don't worry much about the doses given on day one. Sooner or later you learn everything. Just like Priya told, you can't expect to know everything on day one. Okay, so don't get panic or anything. See, more than what treatment you give, how you manage the patient is very important.
Exactly.
Management is not just treatment, but how nicely you talk to them. Okay, how you examine and how you manage the time also. You can't do head-to-toe examination for all the patients sitting in a 100 people long queue sitting, because that too you are in Bihar. Means people will come with the gun. Next patient, okay, next patient.
Nothing like that.
So
one more thing is community medicine is like you count. It's mostly the intern and then the patients over there. So you learn how to counsel them, how to talk to them so well in those 3 months.
Yeah.
That's the beauty of it. And so many skills, IV lines and giving vaccines on those immunization days, antenatal checkup, antenatal advice. injections, intramuscular, dog bite.
Anganwadi visits.
What I
Anganwadi.
would say is, be
My
confident.
favorite posting is
Complete
PS.
postings. What's the most important thing is the confidence. Okay, don't show that you are nervous or
Yeah.
don't that you don't know anything. Be confident. At the end of the day, if you can't help the patient, that's okay. Do no harm to your patient. Okay, if you don't know, just write on paracetamol and that's okay. Okay, if you really want to do something and if you're not able to do, paracetamol is the most safest drug. Okay, somehow by patients see most of the things who come to PHCs, no, will be very minor ones and they get resolved on their own. You need not have to do any treatment only. Okay, most of the time.
Most of the time they'll be chronic patients.
Chronic patients.
They will be having a book of
Chronic-
diabetic
they want
medication
diabetic
or hypertensive medications they'll be
Third
having.
thing
They have to just write it and give.
Either chronic or most of things are psychological. For even for small sneeze also they come to you because they free tablets are available. If you don't know what's a treatment for sneeze,
Most of the time we just prescribe them B complex and give.
B complex or paracetamol. These two are the most safest drugs. Okay, paracetamol or B complex. These two drugs you should know. Okay, and write them and send. Okay, they'll also be happy. That's actually a placebo effect. Oh, doctor has अच्छा दवाई दिया है. देने के वक्त कैसे देते हो वो इम्पोर्टेंट नहीं, क्या देते हो इम्पोर्टेंट नहीं है. ठीक है, मेरा ग्रैंडफादर भी डॉक्टर थे, वो सबको डिस्टिल वाटर को खींच के इंजेक्शन देते थे और सबका दर्द कम होता था. ठीक है, कैसे इतना प्यार करता था पेशेंट को, इतना अच्छे से पैट करके, ओ तुमको कुछ नहीं भाई, तुम सब ठीक हो, तुमको कुछ भी नहीं प्रॉब्लम नहीं बोल के ऐसा देता था ना. वो डिस्टिल वाटर देने से इमीडिएटली पेशेंट लोग बोलते थे, सर इतना दर्द था ना पूरा ठीक हो गया सर. कैसे ठीक हो गया? See, that's called placebo effect. It's written no in our books, pharmacology books. Yeah. So that's more important. How you give is more important than what you give. Okay. So develop on that. So any other questions, Anjali?
For Anjali's question, I just wanted to say, like Priya told about the logbook. I think that's a very good idea, what Priya said. So if you've not gotten your own logbook, you can take the seniors and just see the list of things that they have said we should learn. That's a good place to find it. And also in all the postings, you should learn what the common cases that come are. So
exactly. I wanted to highlight on this. Anjali, there is nothing called minimum or maximum. Okay, learn as much as possible, whatever possible, learn. But the minimum, or this could be the minimum, what Neha told. So there are some certain common cases in each branch. Okay, that you need to know, because if you're posted in a periphery or in the bond during bond time and all, these common cases you get to see day in day out. So at least that management you should know. So like Pallavi told, in medicine OPD, the most common cases are diabetes mellitus, hypertension, COPD. At least that how to do the initiate the management and how to continue, that much you should know. So in ENT, maybe that ear pain, throat pain, CSOM, okay, or TNS, some cases will be there. Okay, rare things anyway you will refer, okay, to the higher center or to the specialist. At least as a basic, you should be able to make a diagnosis and do the basic minimum things. Okay, that's very important. And then I think, like Neha rightly said, that's the minimum skills or knowledge you should possess during each postings. Anything else quickly, Neha? Anjali?
Yes, regarding NEET preparation, like what resources you used and how you started your preparation. Like many people, this is the most frequently asked question in
contents are almost same in all the resources, whatever is available online, offline, wherever. Contents are only the presentation is different. In each thing, presentation only different. Most of my boys here, those who got last year also this year rank, they just read the standard textbooks and they have cleared the entrance exams here. Okay, so it's not that which content is superior, which this thing, which suits you best, depending on your circumstances, the working condition, or your adaptability, which resource, because content is same. Everyone prepares the content as per the syllabus or as per the previously asked questions only. So no content is superior, no content is inferior. Only presentation is different. So whichever suits you the best, just go through that and use it repeatedly. Instead of using multiple resources, use single resources repeatedly. That's what will help you. Okay, regular reading and repeated revision. That's the key. It's not that multiple resources or you read too much that's going to help. No, Same thing repeatedly if you use, definitely. Okay, Anjali, hope it's clear. Anything else?
Like
Anyone
to
else?
add one thing here, everybody has this, there's this trend of fear of missing out. So, you've stuck to one resource, all of a sudden you want to add on like 2-3 more resources. I think the whole point of PG preparation is to make your preparation in a manner that things are concise and you have it in your hand, which is easily revisable in the ending. So, don't fall into that and get in multiple resources and get stuck there, because that will only make things harder and voluminous for you.
Yeah.
Yes.
True, rightly said. Thank you so much.
So any other questions from any members? You can ask some. There are some questions in
The questions
YouTube.
are how to concise resources and to how to funnel out resources for NEET PG preparation. Same question in different.
I think to concise resources, like making your own notes is a good idea, because even if you learn some new fact, you can add it to your own notes, and finally your notes would be your resource. And to check out different ones, it's always, every content, like Sir said, is the same. So it just depends on what suits you. So you just just have a look at all the sample videos and everything, maybe then find what's suited for you best.
And one more, to concise the resources, like every time you read a topic for the once, like read the entire topic once for the first read, and when you read it eventually, just take the point, take or make a square rectangular box around that, that the next time when you go about that topic, just read that particular part which is very volatile. Don't sit and read the entire topic again and again and again and again. Just read the part which you keep on forgetting. Was some basics, so you know as far as you have read it for once time. Just read the part which is volatile. So just take on the points or keep some small bookmarks or clips.
You can see behind Kunj, no? You can see right behind Kunj. So many. Okay, Kunj, now you have got very good rank. Now give all the sticky notes to me. Okay, let me also just go through them and let me try. Okay, once again.
Definitely.
So see, that's how. See, volatile thing which you tend to forget. It's very important. You tend to forget. Make a note of that and put it in like where it's visible clearly every day, so that you keep on going through the same thing again and again. That will become a habituated. You'll get habituated to it. Okay. Good, very good.
And check the previous year question papers also, because multiple questions are repeated again and again, and you would know what topics are repeated and what are the high yield topics, and you can concentrate more on those topics.
And you should see them in the beginning also, not just at the end. After all the preparation, you start solving MCQs or previous year questions. No, in the beginning of your preparations also, you should go through the questionnaires, because you will have a fair idea how the questions are framed, what kind of questions are being asked, from where they are asking. So accordingly, you can prepare also. Otherwise, you would have read only the important points from your book. Then after going through the questions, you realize that no, they are asking from the corner, that boxes, or from what are the lines written on the bottom of the books. Then again, you have to go through the entire book just for that. That is double work. So instead, if you have a fair idea of what the type of questions, how they are framing, what they're expecting us to know, then accordingly we'll read. See, this is all smart work. There is two types of work: hard work and smart work. So if you are really having a short time and all, then you can use this smart work. Okay.
One more question I had, like on an average, how many grand tests or full syllabus tests you should give before fine?
Nothing like that. See, there is nothing called minimum, maximum. I told you, Anjali. It's all individuals' choice. Individuals. See, I may need 1 day to learn driving, whereas Kunj may learn it in half an hour, or Neha may take it 1 month to learn driving. So you should assess your capacity or capability first. Okay. So capability first, and there is no harm solving maximum number of questions. No, what's the harm? You'll definitely get benefited only. There's nothing called minimum. Always aim for maximum. Yes, I say, okay, 100. You should solve this thing. This Anjali, during internship, you should solve 100 and like grand test. Okay, that's your target. Anyone? Okay. Okay.
So not only solving and reviewing those are very important.
Not so this thing. Set some realistic goals and try to achieve, because what I say is, low aim is crime. Okay, my teacher used to say low aim is, if you have a low aim, what is the minimum I should know? What is the minimum I should read? What is the minimum? No, you should always think about only the maximum things. Okay, if I always aim for aims, at least you end up in MMC or LTMC or this way. Okay, if your aim only Bihar ka mai kuch bhi top college mein padhe, so if you aim no, you will end up in somewhere. Okay, correct. So always your aim should be so high. Okay, and your actions of everything will be accordingly. Clear? All these are personal. See, one, I may have to read 2 hours to understand a topic, or I may have to study 3 times to understand a topic. Whereas you may understand a topic only once. You may take only half an hour to read that. So I have to really put in a lot of efforts. I have to read every day 8 hours. Whereas you, if you read 3 hours, you can complete the same thing. So we both cannot compare each other, right? My level of learning or understanding is different. Yours is totally different. So nobody can dictate you. You have to read 8 hours. You have to read this book. You have to read solve 50 questions. Nobody can dictate you because you are different. You are an unique individual. Only you know what's best for you. Which strategy is good for you. We can just give ideas to you, but ultimately it's you. Okay, who makes the decision, and you know what's good for you. You cannot blindly follow anyone or anything. Okay, you have to make a decision for yourself and you have to follow that. That will work out for you. Clear? So
Yes, sir.
every individual is different. What's worked out for Neha may not work out for you, even though she has is the first rank and she tells you all her secrets. Even if you follow that, there is no surety that you will get a first rank.
Yeah.
Is there?
Yes, yes. No, sir.
Like that. So anyway, with that, let's conclude the session. Very fruitful discussion we had with Dr. Priya, Dr. Neha, Dr. Pallavi, and Dr. Kunj, also contributed by Dr. Anjali. So anything you wanted to add, or let's end the session. Thank you so much.
So it was
Thank you.
really a very good discussion, sir. Like all my doubts got cleared, and now I understood what to do further, what not to do further.
Yeah, implementing the same. See,
Yeah,
it's very
yeah.
important. You have the now first sight or overview of the interview.
Yes.
Sorry, overview of the internship. So now that with that confidence, you have to work hard now. Now you
Yes.
have got confidence that you can do well. You will do well. Okay.
Sure.
Now you should do well. You
Yes,
should
sir.
do well when you do the internship. Okay, and make the best use of all the opportunities and get the maximum benefits out of these. Okay. Thank you so much
Thank
for
you,
all
sir.
your valuable inputs
Thank you,
and
everyone.
yes.
Thank you, sir.
Yes.
Thank you. Thank you.
Thank you.